Problems with the gallbladder is a huge one that's coming in. I think that one gets missed quite a lot. I have a lot of women in their 50s who come to see me and they don't even have a gallbladder anymore. Because as we lose that estrogen, the gallbladder starts to become more sluggish, and then you start to have gallbladder attacks and you get gallstones and stuff like that. And the medical treatment for that is gallbladder removal. So just take it out, problem solved. But then you've got problems with digesting fats because you don't have that bile process anymore. So acupuncture actually really helps with that because acupuncture channels are named after the organ that they divert into. So you've actually got an acupuncture channel called the gallbladder channel. So if I was to do treatment on that gallbladder channel, that supports the physiological functioning of the gallbladder.
Welcome to Thriving in Menopause, brought to you by Prevention Magazine. I'm Zoe Mernier, the editor of Prevention, and this is the podcast in which we explore the real conversations, expert insights, and practical tools that help midlife women feel informed, supported, and empowered. Today, we're diving into the growing interest in natural and complementary therapies for menopause. While hormone therapy can be life-changing for many women, others are looking for alternative ways to support symptoms like hot flushes, sleep disruption, anxiety, and fatigue. And one therapy attracting increasing attention is acupuncture. Joining me today is Kim Gatenby, Director of the Australian Acupuncture and Chinese Medicine Association. We'll be discussing what the latest research says about acupuncture and menopause, why more women are seeking holistic support options, and how complementary therapies may fit alongside conventional care as part of a broader wellbeing approach. Kim, thank you so much for joining us today.
Thank you for having me, Zoe.
Now, menopause is finally being talked about more openly, but where do you think women are still being underserved?
It's great that we're having the conversations now, and we didn't have that in generations past, and I think a lot of women missed out because of that. But now we're being a bit underserved because doctors and health practitioners don't always know how to help as well. So, you might be seeking that help and then doctors are a little bit unsure because back in 2002, we had the Women's Health Initiative that came out. It was a research paper that came out, and that actually changed the shape of menopause treatment in Australia. And they did some follow-up research on that showed that doctors actually were less sure of what to do after that research paper came out.
Right.
Because of the implications on breast cancer and cardiovascular disease. So now we have a bit of an issue where we're a little unsure how to approach things, and women are more informed, but we're still having a little bit of a disconnect there in getting that treatment across. So we've got more research coming out about acupuncture as well, which adds to what women can utilize in their treatment space.
Okay, so yeah, you've said there's often a gap between, as we said, awareness and practical support for women. So what does that look like in real life in terms of the women that you're seeing?
I had a woman the other day actually that came in and said she went to her doctor and begged for menopause hormone therapy because she was just having such a hard time. She actually had to beg for treatment, and the doctor gave her that treatment and she had improvements, but she still came to me saying, I've still got this problem, this problem, this problem. There's so many areas that are involved, not just hot flushes. So there's a whole bunch of different areas that can affect health. And she was saying, I don't know what to do. Is there anything I can do?
Right, and so that's where obviously you come in. So what are some of the common symptoms that women are coming to you for?
Yeah, so they're coming in with the obvious stuff like the hot flushes, and then there's the less obvious symptoms like the sleep disturbance is a massive one. Problems with the gallbladder is a huge one that's coming in. I think that one gets missed quite a lot. I have a lot of women in their 50s who come to see me and they don't even have a gallbladder anymore. Because as we lose that estrogen, the gallbladder starts to become more sluggish, and then you start to have gallbladder attacks and you get gallstones and stuff like that. And the medical treatment for that is gallbladder removal. So just take it out, problem solved. But then you've got problems with digesting fats because you don't have that bile process anymore. So acupuncture actually really helps with that because acupuncture channels are named after the organ that they divert into. So you've actually got an acupuncture channel called the gallbladder channel. So if I was to do treatment on that gallbladder channel, that supports the physiological functioning of the gallbladder.
Right. Gosh, gallbladder issues are something that I've really never heard associated with menopause. I thought I'd heard it all, but that is definitely an area that is not well known. So thank you for
So
bringing that.
tons of symptoms. And if you can support women in all these different aspects that's changing throughout that time of life, then we can avoid all those excess surgeries and we can avoid all the trauma that they're experiencing in that process.
Absolutely. I mean, I think a lot of women are curious about acupuncture, but a bit unsure about what it actually involves if they've never done it before. So can you explain in simple terms some of the ways that it may support women in menopause and how it all takes place?
Okay, so if you came in and most people that come in, they're a little bit unsure. They say, I don't know what to expect. So you're going to have a consult, you're going to have a chat. And the great thing about acupuncture and Chinese medicine is that we give a larger amount of time to those initial consults. You've got usually up to an hour. So
Right.
30 minutes of that might be spent having a talk about what's going on. And we don't just say, oh, okay, hot flushes here, we're going to do this. We have those full-on, deep, involved conversations about every little aspect of your life that's not perfect. So like the sleep, like the brain fog, like, oh yeah, I've been getting those gallbladder symptoms as well. And then after the consultation, the practitioner will have worked out in their head what's out of balance. So it's all about bringing the body back into balance. So MHT is about putting hormones back in that weren't there, but acupuncture is about rebalancing the body, bringing it back into its homeostasis. So then you're going to lie on the acupuncture table, and it's really, really teeny tiny fine acupuncture needles, and they just get inserted into different points. And like I said before, it's those acupuncture channels that are named after different organs. So we're trying to tell the body through that treatment what to do. So in a sort of more biomedical way, acupuncture it's how your hormones are flowing through your blood, right?
Yeah.
And your nervous system is involved. When we put those needles in, that information goes back to the brain, and the brain sends out all of the information through your nervous system, through your cardiovascular system. It sends information to the rest of the body, and that's how it's bringing it back into homeostasis.
Right.
And all you're doing is lying there and having a nice rest.
Exactly, yes. And I mean, I have had some acupuncture, so for those that haven't, though, I mean, they're tiny, tiny needles, aren't they? You can barely feel them. It's like a little tiny prick. Not even.
Some of them you don't feel at all. And that's
Exactly.
only just as they're going in. Once they're in and you're
Yeah.
lying there for your 20-minute rest, you shouldn't be feeling anything.
No, that's
If you
right.
were, you would just speak up and your acupuncturist would fix that for you.
Yeah. Just to get that one out of the way. Not painful, people. Okay, so the research around acupuncture and hot flushes has been gaining attention recently. So what does the evidence currently suggest?
Well, the evidence is a little bit here and there. So we've got some evidence that's very positive and some that's neutral. So positive evidence showing that, yes, there's a reduction in the hot flushes, the intensity and the severity. The other research is that the acupuncture was equivalent to placebo, but we have a problem with acupuncture research in that placebo is still acupuncture. So
Right.
you're doing, your placebo treatment is essentially still an acupuncture treatment. It's just a slightly less nuanced acupuncture treatment. So sometimes showing an equivalence to placebo is still a good result.
Right. Can you just expand on that a little more?
Well, when you're doing a research study, you have to have your control group
Yep.
and then your active group. But to control acupuncture, people know what acupuncture is at this point. It's very hard to do a double-blind placebo-controlled trial
Yes.
in
Yeah.
acupuncture. So they do like a version of fake acupuncture where they might do points that aren't the correct ones according to Chinese medicine theory. So they're still doing some form of puncturing of the skin with a needle.
Yeah.
And the thing is that you can puncture the skin in even the wrong point and it's still going to have some physiological benefit.
Gotcha.
Also, those people still feel like they're being treated. So that's that placebo aspect, is that they are getting care in that process. So then your research says that, hey, the placebo worked really nicely and so did the acupuncture.
For sure. Okay, so we've got hot flushes there. You've talked about the gallbladder issues, which can I just ask, so apart from obviously having gallstones and things, what are some symptoms of gallbladder issues that women may not, like, if they haven't been diagnosed, how would they know that their gallbladder is being affected?
Usually people aren't going to notice anything until it gets that little bit more extreme, but you'll have gallbladder attacks. So where you get intense pain. And sometimes that's actually likened to childbirth. And I've had one as well, a child and a gallbladder attack. And I
And you
remember
agree?
at the moment thinking that, oh, wow, this is a lot like childbirth, but without the baby. So
Yeah.
it is quite intense pain. For me, it radiated into my spine. And I was on all fours, same way I was for childbirth. So it's that very, very intense pain. It's not always located in the upper right abdomen where the gallbladder actually sits just below the liver. You can actually get that referred pain into other parts of the body. But obviously you should seek medical attention if you're getting such extreme pain.
Yes.
But women are often getting these episodes of pain, or they might be getting some gastrointestinal disturbance. They might be getting a bit of nausea, particularly after eating a meal that contains fat. So any sort of fatty meal, and dinners tend to have like a high fatty sort of component to them. And then in the middle of the night, you're waking up going, oh, I feel really queasy and my back hurts, or my upper abdomen hurts, something like that. Yeah, these
Right. Okay.
painful episodes.
So we can see that acupuncture has been very effective in those sort of areas. So what are some other symptoms in which acupuncture has shown to be really effective?
In menopause?
Yes.
Yep. Sleep. Sleep is a massive one. A lot of help with sleep there. A lot of women aren't really equating the fact that sleep disturbance is actually creating a whole bunch of other flow-on effects as well, like your brain fog that you're getting in menopause. Your hot flushes are going to be worse when you've had poor sleep. If your gallbladder's waking you up in the middle of the night, that's an effect. If we can treat the gallbladder, we can treat the sleep, we can treat the hot flushes, we can treat the brain fog. So it all flows down together. I think the mood disturbances are a big one for a lot of women. I always like to think of menopause as you've had your puberty, and that was really rough. And everyone goes through puberty, so we all experience that. And then women are on the other side, at the other side of our reproductive years, we're getting our second puberty in a way, we're getting our menopause symptoms. And it's hard on the brain and it's hard on our emotions. And we often have children running around and huge demands on our life.
Yeah.
And they're feeling really anxious or they're feeling depressed. And then they're self-medicating in their lifestyle in ways that aren't actually supporting their health as well. So yeah, using acupuncture to manage the sleep, manage the mood changes can make a really big impact on how they feel and how all of those other symptoms start to come back into balance.
Do you think women underestimate how connected the nervous system is to hormonal change?
Absolutely.
Yeah.
When I'm having these conversations in clinic, the patient's eyes are wide open saying, wow, I had no idea that all of this is linked. I just came in because I was getting some hot flushes. And then actually all of these other things that are going on for me are all tying in together. And one of the first things that will happen is when you start treatment, acupuncture is considered cumulative. So every session you're getting that little bit better.
Right.
And it's not the hot flushes that they necessarily notice change immediately. They'll come in and say, oh, I slept so well after that treatment. And I'm like, yeah, and how do you feel now? How do you feel after a great night's sleep? Oh, so much better. My husband's not irritating me anymore. I can get on with my day. I'm doing my job better. Everything feels better because the mood will follow the sleep.
Absolutely.
And then in a few more sessions, we've had that cumulative effect and we're starting to notice the drop down in the hot flushes and the things that they actually came in for.
Yeah. So would you say that's one of the things that surprises women most about their treatment, or are there other things that stick out that women are quite surprised by when they start undergoing treatment?
Yeah, they're surprised by all of it. They're so excited because everything that they didn't realize wasn't optimal. Because when things start to go badly, you don't really notice the absence of perfection. You start to just go, oh, here's the main thing that's bothering me, but there's a whole bunch of other things, and they're just sitting down at a level 2.
Yeah.
2 out of 10 on the intensity scale. And they're saying, okay, it's not perfect, but whatever, it's not my biggest problem. And then as those things start to fall away, they're saying, I didn't realize I could feel this good again. I often see patients expecting aging to be this decline, and it doesn't have to be a decline. You can climb that aging mountain at any point and feel better.
Yeah. It's very encouraging. Now, you've spoken about acupuncture as being part of a broader integrated approach. So what does a well-rounded menopause support plan look like to you?
I think doctors should definitely be involved. You should always contact your GP. Also, after that 2002 study, the Women's Health Initiative, because a lot of women stopped doing their menopausal hormone therapy, we've actually got a situation now where there's more problems with bone health as well. So I don't want women to miss out on seeing their GP and
Yeah.
getting the support that they need. We've also got a lot more awareness now about premature ovarian insufficiency and people going through menopause sooner. And those people should definitely be seeing their GP and considering that hormone treatment. So I think an integrative approach is always better. And even the research even backs that up, that integrative medicine is actually the best medicine. We're not a us or them situation. Using everyone is always going to be better. So see your GP first, get the support that if you need that, fantastic. And then use the acupuncture as well to work on those little bits and pieces that start to make it all fall together and give you your best health back again.
How do you balance traditional practice with modern medicine? What's your way to marry the two effectively?
You can see any practitioner you like, whether it's a GP or an acupuncturist, or go and get any sort of treatment that suits you best, your psychologist. They all should be working together.
Yeah.
So that's that whole the us and them. I hope that doesn't really exist anymore, because we are all here to support patients. And I think that's everyone that works in healthcare, that's their goal, is to help their patients. So you can go and see your GP, have treatment with them, take that information from them and speak to your other healthcare practitioners. So that's how it integrates. Over in China, they've taken it a step further, and you actually have that integration in the hospital system. So when I worked in China 20 years ago, I was actually in the acupuncture department. And for example, when I worked in oncology, people would go and have their radiation, their chemo on one side of the hospital, and then they'd come over to our side and they'd get their herbs and their acupuncture. And so they were supported in that one building,
Yeah, fantastic.
holistically for their whole treatment. So here in Australia, eventually we hope to be part of the Medicare benefit scheme.
Yes, that would be nice.
At the moment, acupuncture is only available privately. So yeah, if people can just, you do have to see different people. You have to see the GP, and then you have to go and see your acupuncturist, but together they are still working together. They're not actually conflicting treatments.
Yeah, so you wouldn't treat someone any differently if they were already using, hormonal treatment to how they would if they've,
It doesn't preclude their ability to have their natural therapies. So you just tell your practitioner, hey, these are all the medications that I'm taking. And we say, great. So what's being well managed already and what still needs some work? And then we support whatever's remaining.
Perfect. Love that. So what would you say to women who are curious but still a little bit skeptical about acupuncture?
Oh, skepticism is always a little bit healthy, isn't it? So
Yes.
you can always question things. I'd say reach out to your local acupuncturist. Go to acupuncture.org.au, look up whoever your local acupuncturist is, and have a chat with them and say, here's my situation. Do you think you can support me?
Yeah.
Because that's what we want to do. We work in this industry because we want to help people, and you should ask the questions. I always say to my patients, there's no silly questions. I want you to ask the questions that you have so that I can make you feel reassured.
Absolutely. So when someone comes to you, how long would it typically take someone to start feeling the benefits?
Personally, I like to see some benefits within the first 3 sessions.
Yep.
Ideally, you feel something in the first session. You usually have that good night's sleep. So then you go, okay, great, I feel a little bit better. I feel more myself, a little bit more human. And then the next session, it might not be as dramatic, but then we've started to build on that still, because it's not dramatic because you already felt a bit better.
Yeah,
So that big shift, then each session you start to feel better and better. By the third, you're saying, okay, those symptoms I came in with, yes, they're definitely improving. We call a course of treatment about 6 treatments. So in those 6 treatments, you should have significant benefit. Because acupuncture is cumulative, it doesn't just keep building up and then last like that forever. You do have to generally maintain that. And then once you've got the improvement that you want, you start to space things out to a maintenance level. And that can look different for everyone. I usually say to people, if you're seeing your acupuncturist at the change of season, you're supporting your best health.
Okay.
You're supporting through those changes.
Yeah, that makes sense. Absolutely. And are there certain menopause symptoms where acupuncture maybe isn't the right fit, that it probably wouldn't help that much?
Well, I think anything serious, you need to see your GP.
Yeah.
If you're having severe mental health episodes. You can have menopausal psychosis that needs to be referred straight to psychologists. I would say start with the GP if things are really, really severe.
Yeah, for sure. Okay, so what should women look for when they're seeking a qualified acupuncturist?
What you should look for is AHPRA registration, so the Australian Health Practitioner Regulation Agency. You can actually go to their website and look up your chosen practitioner and say, are they in fact registered? Then I'm with the Australian Acupuncture and Chinese Medicine Association, so we have AHPRA, then you have your peak representative bodies, and then you want someone that's also insured, but yeah, that should be covered as well.
And I guess are there certain acupuncturists that do specialize in the menopause section, or will most acupuncturists be able to, understand the specific needs
Yes.
of menopausal women?
Yeah. So all acupuncturists should be able to treat all patients because acupuncture is built on a system of healthcare that's about bringing balance back into the body. However, there are going to be people who've done extra training. So like I've done menopause training in my master's degree. So I have that little bit extra knowledge. But the average acupuncturist can support anyone because we're bringing things back into balance. People might prefer, if they feel that their situation is very complex, then yes, they might look to find someone that advertises that they have a particular interest in menopause. We aren't allowed to have specialization in Chinese medicine. That's reserved for the medical system.
Right. Okay, so if a woman listening today is feeling, overwhelmed by her symptoms, what would be the first thing that you would suggest that she does?
I'd say book a couple of appointments. Get on the internet, book online so you don't even have to call someone and speak to them. Just book in with your GP, look up your local acupuncturist, book in with them, and you'll feel so much better because you've taken that first step. So that's going to give you support. But if you want something practical to do, I would say focus on the sleep because that's going to make everything that little bit easier. So I work on I call it a sleep hygiene routine at the moment. So I've started reducing my phone usage in the evenings. Nobody likes to hear that, but you should be doing it. So I put the phone away. I went to my local library. I told them what I needed in a book and they gave me some. So now I lie down and I read before bed.
Yeah.
Okay, so it's about supporting that sleep hygiene. You can support your melatonin production by reducing all your lighting in the evening. So turn off the overhead lights, do warm lamps, change your phone screen. If you are still a little bit addicted to your phone, change the screen so it's not blue. So it's giving that orange color instead. That sort of sleep hygiene is going to give you that little bit extra sleep and you'll start to feel more like yourself. And then you'll have a little bit more energy to tackle the fact that you need to go in for an appointment.
Yes, absolutely. All right. Well, look, is there anything that we haven't covered that you would really like to address?
I'd really love women to know that menopause is normal and you're meant to go through menopause. And I feel like there's a lot of stress around it these days. And it's great that we're getting the conversation going.
Yeah.
But it's creating a bit of anxiety in people as well.
For sure.
And I have a beautiful friend of mine that keeps sending me messages. She keeps forwarding me stuff that's part of her algorithm on Instagram. She's getting all of this perimenopause doom and gloom stuff. And I keep saying to her, I'm like, you've rigged the algorithm because I'm not receiving this stuff in my algorithm. So she's freaking out. She's in her mid to late 30s, freaking out. And I said, you don't need to worry. You may not actually get all of these symptoms that you're hearing about.
For sure.
And even if you do, we'll support you through that.
Yeah.
We'll make it easier. And you could just come through the other side because you're meant to go through menopause. And it's not a scary thing if you're well supported.
Absolutely. Well, look, unfortunately, that's all we have time for today. So please join me in thanking Kim Gatenby from the Australian Acupuncture and Chinese Medicine Association for sharing those fascinating insights.
Thanks for having me, Zoe.
Thank you so much. And if this conversation resonated with you, make sure you subscribe to Thriving in Menopause so you never miss an episode. And if you enjoyed today's chat, please rate, review and subscribe. And as always, for more great advice on living your best life at midlife, pick up a copy of Prevention magazine. I'm Zoe Mernier. See you next time.